partial inference. Okay. Okay, good morning everyone again. I hope you are all in good condition and please open your video. Some of you haven't taken their breakfast just like me. Some of you may not just may be just woke up, but this is what it is. 7 o'clock p.m. supposed to be going to the school, to your class, and topic that we're going to discuss for today would be about the cause and effect. Now, if you're gonna be waking up late and you failed to prepare for your examination, what would be the effect? Supposed to be, I will give examination at 7 o'clock, exactly sharp. Can someone tell me what would be the effect? If you wake up late, say your alarm got off, and prior to that, you're not able to finish reading your assigned topic for your examination, what would be the effect? Guys, I'm asking first practical questions. I'm not even asking theoretical. Open your microphone if you want to answer, or raise your hand so I can call you.
You will fail, doctor, if we don't prepare.
Yeah, Mohammed, can you please open your video? You will
Yes, sir.
fail if you fail. If you fail to plan, then plan to fail. Correct?
Yes, doctor.
Okay, and then eventually, what will you do if you're not able to? Say, for example, you came late, so you missed already about 20 items. Good thing if the professor will allow you to take your examination even if you're late. Then most of the students, come on, let's be honest here. What would they do if they are too nervous that they will not be able to answer some questions in the examination? What will they do? What do you think would be their next course of action? Kamalapuran?
Exactly.
Yeah, if you're gonna be in that situation, you're almost like 50 minutes late, and then you're seated at the back. What would your classmates or you would do? Come on, you're smiling. I know what you're thinking. You could probably what? Tempted to what? Kamalarupan. Can you hear me? Kamalarupan. Can you hear me? Why are you not Why are you not answering? Balamurali. Kamalarupan.
Exactly.
What? What would you do?
I
I might. Are we gonna wait for 1 hour just for you to answer?
no.
What? Sushma. What is it? Every time I ask you questions, you would always give me blank stares or taking you a couple of years to answer me practical questions. Good question. Abhishek.
Yes,
Abhishek.
sir.
So what happened now? If say what happened now if you fail to review or say you came late, what would be your temptations? You would be tempted to what?
Hello, doctor. I don't understand the question, doctor.
I don't understand the question. You came late. It is your examination day at 7 o'clock. It's already past 15 minutes. They already started the examination and you will be seated at the back.
Mm, so, doctor, it is that is it evaluate your body observation and precaution and auscultation if you late in the examination.
Do you need observation? I'd like to hear something. Truthful answer.
Examination.
You failed to
Uh,
prepare. You came late.
uh,
You were too
uh,
nervous. You're so anxious.
oh,
Can someone please chat? I am taking a
sir,
point here. Cause and effect. That is the topic for today. Causality. The cause and effect. I am just making a statement or a point here to give you example of the cause and effect. Can someone please answer or I'm gonna leave this class?
Hello, doctor. I think you will be
Yes,
tempted to cheat.
Mohammed, you're the only student that is actually paying attention today. The rest of those are not really here. Can I mark you all absent except Mohammed?
Doctor, can I answer, doctor?
You see, that's the problem. I am trying my best to connect with you, make you engage in this session. That's why if you notice, I sometimes ask questions that can be also personal, and yet you don't seem to care. Huh?
hello, sir. Can I answer, sir?
I don't know. I don't know with you, but Abhishek,
Okay, sir.
what kind of lecture or what kind of profession you would like to have? A robot lecture? Lecturer? A robotic lecturer? They would just keep on talking and talking even what? Is this the kind of profession you would like to have each session? It's not even checking on you, Sushma. Sushma Pasedula, I called your name.
Yes, sir.
Yes, and you didn't give me an answer.
Yes.
Kamalarupan, is that question too difficult for you to give me an answer? Kamalarupan? Okay, from now on, I will not gonna ask questions. I don't care if you're listening or not. I just keep on talking until the end of discussion, and that's it. You should know by now that I usually make my students involved in a discussion because that is the purpose of learning. This is not just a one-way process. This is a two-way process. I ask question, you give me answer. You ask question, I'll give you answer. Like Muhammad,
Yes, doctor.
that's the only way I can check that you are really paying attention to this virtual class. Don't you think that you should be actually glad to know that I'm trying my best to get you all engaged, even if it's virtually. I would understand if you are toddlers or 5 or 7 year old kid with a very short attention. You are all adults here. If I, if I would observe my nephew or niece taking a virtual class like this, they have full attention. They even try to take down some notes while listening to their professors or teachers. I asked all of you to open the video, and until now, I haven't seen the video of other classmates. You would just open this if I'm gonna get ask you to have this as as an attendance. That I can talking and talking here for the last 10 minutes, and yet a simple instruction to open the video you cannot follow. So you are going to what? Is this gonna be all the time I'm gonna have lecture with you? Then we will have face to face. I am not ranting or being strict for no reason. Don't ever think that I'm just talking here, ranting, just like your nagging mothers. But for no reason, huh? I am teaching you here, virtually or whether it's face to face. I'm still the same professor that you would encounter. Ask questions, make my students engage. I even told you to use the chat box. I even told you to raise your hands if you want to answer or want to ask questions. So going back now, it's already 7:28, and just give you still introduction to the topic, which is causality. You know, guys, you will understand this once you become a professor yourself. And also remember that I used to be a student like you. Before I reached this stage of my life, I was also a student, and until now, I'm a student. So whatever you're thinking against your professor, I have already taught that too. Okay? Your professor gets their inspiration from whom? From you, from his students. We also get motivated by you. You think I'm going to get good motivation? if I don't see engagement from my classmate, from my class, as if I'm talking to dead people. This is already the third session I had with you virtually, and I don't seem to see any improvement. Can you please confirm if you can see me, my slides?
Yes,
Yes,
doctor,
doctor.
we can see.
Yes, doctor.
Yes. Okay. So basically, in epidemiology, you need to learn about of concepts or theories that would affect the study of the diseases, or in fact also our research. So that's why we're going to discuss today causal inference in epidemiology. Excuse me. So in here, we will have to learn the concepts of causality. We will also have to understand some terminologies such as relating to exposure, outcome, and statistical association. When we talk about exposure, we talk about the causes, the risk factors, and these are the independent variable. So when you talk about outcome, what would be the effect if you have this exposure? Hence, the consequences like diseases, injuries, disabilities, and these are the dependent variable. Okay, to further understand, giving example, what would be, okay, can someone give me an exposure and an outcome? This is the cause, and what would be the outcome? Can someone please give me an example of an exposure and an outcome of a cause or effect?
Hi. Hello, doctor.
Yes, who are you?
Mohammed Imad, Mohammed Said.
So, Mohammed,
Yes, doctor.
are you the only student I have right now? You keep on answering. Give other
Doctor,
people
can I try to
chance.
answer?
Okay. Yes, go ahead.
Exposure, when we exposure to the disease, outcome may be the illness, doctor. Like if we got a disease, we're going to be feel sickness.
Okay, other than that, very good. Can you give me an independent variable or a cause that would give an outcome that is actually already proven? Is it difficult to think? Oh my goodness, guys. Example, smoking. What would
Causes
cause
cancer.
it?
Causes
It could
cancer.
cause cancer or simple as that, guys. Come on. Okay, too much eating or fond of eating sweets or maybe high
Causes
cholesterol diet. It could cause what?
high sugar.
So
Causes
this is
diabetes.
your exposure and outcome. And this can also be put into numbers and statistical association versus your biological causation. Okay? And if we're going to have it also done in a research, you would actually get relationship between two variables. That's why you have your independent and dependent variables. Now, there are certain types of causality or levels of causality, such as it could be molecular or physiological, personal, social, deterministic, probabilistic, and what aspect of environment, no, in general, will be removed or reduced that can actually give you an outcome. So let's try to look into this, no? some definitions. If we mean by deduction, it actually just tell you that some generalization to be in particular. You try to deduce, you try to get the details from general to a particular. Induction is method of logical analysis that relates particular to general. So this is the opposite now of your deduction. Conceptually bright ideas, breakthroughs, and ordinary statistical inference belong to the realm of induction. You probably think it's a simple idea that can actually go through a broader or even brighter idea. That's why sometimes if you're gonna do a work activity, you try to do brainstorming, and then each of you will have an input to the idea, and then you try to collate them, and then come up with the bigger picture or concept, no? And then you come up with your plan. So induction period required for a specific cause to produce the disease, usually longer than the non-communicable diseases. So when you say induction period, there is a time element, no? And this time element, you would always say to your patients that mother or sir, ma'am, it is not something that happened overnight. You have been exposed to this kind of chemical, to this kind of habit, this kind of lifestyle for the like past 15, 20 years of your life. You are fond of eating this, you are fond of drinking that, and that is actually the induction period. That's why if you're going to do also your clinical history, it's not enough that you ask question like, are you a smoker? Yes or no. The next question would be, how many years have you been smoking and how many cigarettes per day? That's why you can compute. How do you compute for that? If he is a smoker, you compute it by pack per year. Okay? You count the number of sticks that you consume per day, how many sticks per pack. How many sticks per pack? For those who are smoking here, how many sticks of cigarette per pack? And my class is still silent.
20, doctor?
20, yes, 20 sticks per pack. And if your patient has been talking, I am a 40-year-old, okay, and I've been a smoker for like 20 years. Since I was 20 years old, I've been smoking. And then how many sticks per day? I would consume probably 10 sticks per day for the last 20 years. So how many packs here am I? Am I 5 pack here, 10 pack here, 20 pack here? Let's say pack, no PACK. So since this is 10 sticks per per day, so it means I am not consuming the entire pack. I am just consuming half of the pack. So if it's going to be half, and I've been smoking for 10 years, then I am a 10 pack smoker. Can you follow?
Yes, doctor. Yes, doctor.
But yeah, but if I'm consuming 1 pack per day, so you would assume that the patient now would be a 20-year pack smoker because of the 20 years, she would not probably tell you that, hey, it's just an estimation, right? You don't need to be very specific, and we're just giving you a picture that this patient has been smoking and this is also consuming these cigarettes for that entire period. So that is your induction period that require for a specific cause to produce the disease. That's the time element. However, there are also induction period that can also be short term, acute exposure. No? So you have your acute and you have your chronic exposure. Can you give me an example of an acute exposure? That can give you a health-related outcome.
I'm sorry, doctor. Could you repeat the question?
Acute exposure.
Your internet is a bit choppy,
Can you
doctor.
give me an example of an acute exposure? Acute
Doctor, yeah.
versus chronic. Okay, what disease outcome? Okay, hello, hello, hello. Can you hear me? Hello,
Doctor, your internet is a
hello.
bit choppy.
Hold on. Yeah, I had instability of my connection. Can you hear me now?
Yes, doctor.
Okay, sorry about that. So we're talking, okay, can you see my slide again?
Yes, doctor.
Okay, so you have your acute and chronic exposure. Sometimes the acute exposure can be what? Communicable or infectious diseases. No? If you're going to get exposed, especially if it's viral, an incubation period of 3 to 5 days, you're exposed to a patient having the viral disease, can give you now or give you an outcome that you might actually be also contaminated or had the transmission. So that's why we want to know what is the incubation period by the time you were exposed to the time that you develop what your first signs and symptoms. Correct? Correct?
Yes, doctor.
Yes. Okay. Another definition, association or relationship. These are your statistical dependence between two or more events, characteristics, or variable. Positive association would be direct relationship, while negative association would be inverse. Okay. For example, if I would eat more sweets or if I would eat more carbohydrates, and the result would be gaining weight. If I would be sedentary and not having much of time to go to the gym, I would have also going to gain weight. However, the more time I spend, no, to the gym, curbing down my diet or carbohydrates intake, that would have positive association of losing my weight. Now, can you give me a negative association where if you try to increase, the effect would decrease? Anyone, please? Can you give me a negative association that is inversely proportional? Can you give me an event or two variables that is opposite? Guys, think of something that will actually give you an opposite outcome.
Uh, Doctor, when you try to dig a hole inside the ground,
And
you take the sand, you increase the value of the sand, you take the deeper the hole go inside the earth, inside the ground.
The more you dig in the hole, the more you actually goes down, but the
Yes,
number, the amount of sand
increase.
increases. So opposite. Example, if if I would produce lots of onions, I would produce lots of onion. I have more supply. And there is actually no demand, but I have lots of onions in the market. What would be the effect in the price?
It
Is
will
it
decrease
going
cost.
up
It
Mm.
will
or
decrease.
going down? So
It
it
will
would
decrease.
decrease. That is your law of supply and demand. If you have high or many supply, the demand is low, it would now affect the price. But if I have too little supply and there is a big demand of onions, what would happen to the price?
It
Will
will increase,
increase.
doctor. Increase.
And that is what happening in the Philippines for the past few months.
Yes, for
Okay, if you hear the news about prices of onion, then this can also be true with your oil price hikes. If there is a high demand on global market of oil, especially during winter, you would expect that the supply goes down, the high goes up. And that is your inversely or negative association. Okay? So we now know the causality, causation. We also know the cause, an event, condition, or characteristics. It can also be a predictable change in occurrence with the outcome. Sometimes the cause can be genetic or environmental. You know, if you're gonna be asked by someone, what causes cancer? What would you often tell them? I don't
Smoking?
understand, doctor. I don't understand, doctor, why I had this cancer. Where did I get this? Can you still hear me?
Yes, doctor.
Okay. Who's answering this? A lady. Who is this?
Doctor, it's me, Snigdha.
Digda. Okay, you have a good audio voice. Can you please answer this question?
Doctor, if I'm hearing you right, you just asked the cause of cancer, what we usually tell people, right?
Yes, yes, that's correct. If someone were gonna ask
Smoking?
you, can you be more general when you answer those questions? I don't need a specific example. Say, for example, I'm just saying that what if your brother or your sister, they know that you're already in the medical school and then someone asks you, why do you get cancer? What's the cause of cancer anyway? How can you explain to them the causality of cancer? In general, you are giving me one specific example, but I need a general answer.
We
You're
could
correct. You're correct.
explain that. We could explain that some carcinogens, some cancer-causing substance.
Correct. You could have exposure to these carcinogens or harmful substances that the body would not recognize. And the example would be smoking. Smoking is not a natural substance in the body, and yet we are keep on introducing it to the body, and it would actually going to be what else? So it's just a cancer. It's just the substance. But I'm not smoking anyway. What if?
Certain genetic factors.
Correct. So some genes that also can be hereditary, or they can also be mutation, or the body is now trying to. So basically, these are abnormal cells. No? The growth of these abnormal cells that brought about by certain genetic mutations, certain exposures, certain harmful substances. even in your family history, all of this can lead to development of the cancer. Can you also say stress can lead also to cancer? How
Doctor, your
about
voice
stress?
is not clear.
My voice is not clear. Okay. Or how about stress or lifestyle? Hello, can you hear me? Hello?
Uh, yes, yes, doctor, but it's not clear.
It's not
Uh,
clear. Okay. How about lifestyle or stress level? Do you think it
yes,
can cause cancer?
the
It can
lifestyle. Yes,
probably.
doctor. Yes,
Can
doctor.
probably
Yes, the
cause
lifestyle.
cancer. Yes.
Yes. So you could just able to answer them that it's a multifactorial disease. You can never pinpoint one substance or one factor in the development of that cancer. But mostly, cancer would have an exposure or would have a genetic mutation in the body. Okay? Okay. When we say deterministic causality, cause closely related to effect, this is necessary or sufficient cause. You are determined, you are sure that this is going to be the cause. I am sure that you're going to fail this class if you're not gonna pay attention to our discussion. I am sure that I'm going to make your examination even harder because you're not studying the topic. You're not even answering me some questions in the discussion. I am sure of that. See, that is deterministic causality. But in necessary causality or cause must always precede the effect. The effect need not be the sole result of the one cause. I might give you a good grade, not because you are good looking or you are kind, but this is not basically the real cause of why you get that grade. The real cause of getting good grades because you were able to study the topic. So necessary cause must always precede the effect and did not be the sole result of the cause. Sufficient cause, inevitably, you can never get away with this, initiates or produces the effect. These are the component, which includes the component causes. So this means that this should be present for you to have a certain cause. You can never have the cause or the effect you need if you don't have this sufficient cause. So, for example, how can you accuse someone that they killed a person if this person is actually not present in that scenario? So the first thing that you will always hear in an investigation, where are you during this time? I was in the province, blah blah blah, and then making alibis and stuff. So the first question, where were you when the murder or the crime happened? Because that is a sufficient cause. Ah, you are in the vicinity at this particular time. So the first thing that they need to prove is that is there a sufficient cause for this person to be accused of something. Okay? So any given cause may be necessary, sufficient, both, or neither. Okay? Component causes together they constitute a sufficient cause for an outcome in question. In communicable diseases, CB and CB are non-communicable. When you say communicable diseases, these are your infectious diseases. This can include or may include biological agents. such as environmental conditions. So, for example, tuberculosis, measles. What would be the biological or environmental condition for you to develop such diseases? Murugayan, pasokan, pasokan, janani.
Yes, doctor.
Yes, you know for the fact that tuberculosis is prevalent in your country, in my country. What could be the biological agent that cause tuberculosis or and environmental condition for your patient to develop the disease? You have studied this in microbiology and parasitology as well.
Yes, doctor. Mycobacterium tuberculosis.
The causative agent would be your Mycobacterium tuberculosis. Yes, correct. And what would be the environmental condition? Where do you think this disease is more prevalent and why? Can someone please help your classmate? Don't Google your answer. All the answers should not be found in the internet. You use your head. Don't be too dependent in your technology. Dasari, Amarana.
Doctor, yes, doctor.
Yes. What would be environmental conditions?
Mm,
Environmental conditions wherein you can develop tuberculosis. Your classmate already answered biological agent.
yes, doctor.
That's the
Mycobacteria.
mycobacterium. That is the biological. I'm asking you now the environmental condition.
Doctor, it may vary, doctor. It's after if a person got infected by the rusted nail, that having
Environmental. We're talking about surroundings.
Doctor, pollution may cause.
Pollution. Correct. So those people that are already exposed every time outside on the roads, these are your traffic enforcers. They are exposed every day to this dust, smoke. These people are prone to develop diseases. That's correct. Pollution. What else? Environmental conditions. What else? That's you're correct. Apart from pollution,
Doctor, smoking as well can cause.
Air
of course,
pollution.
yes, we have
Doctor,
your air
smoking,
pollution,
smoke,
smoking. Yes, yes,
al-
correct.
alcohol intake.
Maybe alcohol intake because of what? We're talking about environmental. What's the environmental in alcoholism?
Hello,
We're
sir.
talking about surround.
Overcrowded.
Very good, very good. Crowded areas, overpopulation. People tend to be living in those poorly sanitized environment, crowded areas, on those quarter chanty villages. You can also get this disease because of the high transmission. There is no good ventilation, right? So these are your component causes. In non-communicable diseases, this may include a whole range of genetic, environmental, psychosocial, behavioral. An example would be your diabetes, cancer, no, ischemic heart disease. You see, probabilistic causality in epidemiology, most associations are rather weak. For example, there is actually a study wherein the relationship between high level of cholesterol could actually cause ischemic heart disease. Now, we're not talking about atherosclerosis or mention. We're talking about ischemic heart disease, which is neither necessary nor sufficient. Okay? So it doesn't follow that if they had high cholesterol, that patient would cause an ischemic heart disease. And ischemic heart disease is not the causality, no? So you know in your pathophysiology that ischemic heart disease can develop not related to your high level of cholesterol. However, if this heart disease can be related to cholesterol or dyslipidemia, we're talking about here atherosclerosis, right? So, multiple causes results in what is known as web of causation or chain of causation, which is a very common concept in non-communicable or chronic diseases. It means that one factor, multifactorial, can cause or can be interrelated. So the effect measures or the impact factors. So when you say effect measures or odds ratio, risk ratio, and impact factors are closely related to the strength of association. So in study or research, this is how you prove the association by computing the odds and risk ratio or getting the population attributed to this. So you cannot come up with a conclusion without giving us a proof. And that proof can be actually be equated to statistical measurement. No? Is this one variable affecting the other variable? Prove to me by statistics, by numbers. So the higher effect measures and the population attributor rates, the more exposure is the predictive of the outcome, which is closer to 100%. So meaning, no, the population attributable risk of 100% means that the factor is necessary. So the higher you are to the 100% or the closer you are to the 100% of the population attributable risk means that this factor is necessary to produce or to associate it as a cause of an outcome. Okay? So example of your necessary cause. If outcomes are defining in terms of causes, the cause is necessary the cause is necessary by definition. For example, the tubercular bacillus is necessary for tuberculosis by the definition of the disease. Etiology, as contrasted to the manifestation, classification of disease can also often produce necessary causes. Example, no? Hepatitis B was once looked to be necessary cause of hepatocellular carcinoma or cancer, liver cancer. But now we know that hepatitis C can also produce liver cancer. So for the example of tuberculosis, unless we are establishing it if it's a necessary cause. So meaning if your patient has the disease and has their exposure, then this is yes. If he has a free of disease and he has exposure, yes. But if he has the disease and there is no exposure, you have no. And if it's free of disease and no exposure, is this is still or indeed free of the disease. However, no, if he has the disease but there is no exposure and this can be does not have exposure, you can never say that he really has the disease. Okay, can you follow? So necessary cause, it is by the word itself, it's necessary. It is needed. It is a uh, included in your investigation for what would be the cause. Sufficient cause. These causes are very rare in medicine because it's exceptional. But one exposure by itself would actually cause or be enough to cause the disease. Unusual exposure are more common than disease that they cause. Only about 5% of those people who are smoking will get cancer, lung cancer. The measles virus virtually always causes people to get clinical measles, but the rabies infection will always be fatal. So this would be your sufficient cause. So putting that in our table, if you have a disease and you have that exposure, then indeed you had this sufficient cause. But if you have, or for example, no, in this table, rabies infection, you don't have the disease, you are free of disease, but you have and you don't have the exposure, and that would be a sufficient example, no, sufficient cause. Free of disease, and there is exposure. If you have the disease and you don't have the exposure, but still you have this yes, and you don't and you have free of disease, but you doesn't have you don't have the exposure, you still have come up with your free of disease. So this would be gives you or illustrate you a free or sufficient cause. What can you uh, comment on the two tables presented? Necessary cause and sufficient cause. Looking in this table, so you see, guys, we're talking about here exposure and outcome. No outcome with with exposure, no disease with disease. Okay, and what is necessary for that to develop? And this is what we would like to investigate. We are differentiating it into sufficient and necessary cause. Another example of necessary and sufficient cause, HIV could once be classified as both necessary and sufficient cause. However, it may also be one can be infected by HIV and never get AIDS, either because of rare genetic protection or because of treatment of the virus. So, in this patient having both necessary and sufficient cause, for example, HIV in the past, you have the exposure and you have the disease, all of them would have or develop your HIV. But now it doesn't have exposure and it doesn't have the disease, none. But some people will develop disease, so even if they don't have that exposure because of the genetic or it could also be caused by some viral treatment. No? So let's talk about your predisposing or precipitating factor. We often hear these two um, definitions or concepts. No? When you say predisposing factors, factors that prepare, factors that create a situation so that the host tend to react in that specific fashion to a disease agent, such as your personal interaction, environmental stimuli, or specific incentives. So, for example, your predisposing factor could be age, marital status, education status, no, or educational attainment. These predisposing factors could prepare the host to react on that particular scenario or stimuli versus your precipitating. So, for example, no, what would be the predisposing factor to develop sexually transmitted diseases? Can you give me an example of predisposing factor
Doctor, can I try to answer?
Yes, let's try.
Predisposing factors that, for example, breast cancer, it's only depending upon the sex means, for example, breast cancer, it only affects the women, doctor. Like it's only by specific, only the sex. It cannot affect the males, no, doctor. So predisposing factors by concluding the sex, so you can tell that.
Breast cancer,
Uh, yes,
what
doctor.
do you mean?
Means
I'm asking about sexual transmitted diseases, STDs.
Doctor, not using protection.
gonorrhea, doctor.
Yeah, that's
It
an
can,
example.
it,
Okay,
it
not
can affect the females.
Doctor, unprotected sex is a predisposing
unprotected.
factor.
Yes, unprotected sex is a predisposing factor. You're correct. It's not even the gender or the sex, but
Okay, doctor.
among the gender, who would be age group, or say for example, what kind of occupation that can actually also put it or make it a predisposing factor. Can you consider the occupation as a predisposing factor?
We can, yes.
Yes, especially those who are
Um, those who are
Sex worker.
females in yeah, female sex.
definitely are female sexual workers. Who else? We're talking about the factors of exposure. Of course, your productive age group, right? They will be engaging in sexual activity. They are the productive age group. The productive age group. Okay. So even the gender preference can also before they could also attribute to developing sexual transmitted diseases. Now, what is your precipitating factor? Those associated with the definitive onset of illness, disease, accident. So these are associated, but not actually going to synthesize or prepare them. Example would be exposure to specific disease, amount of level, drug or physical trauma that can lead now also to develop, but it can be associated, no? Occupational stimuli, exposure. So this is your precipitating, can be associated with the definitive onset of the disease. So can we now differentiate between the two, predisposing and precipitating?
Yes, doctor.
Precipitating can also aggravate, no? Aggravate its exposure, aggravate the condition that's precipitating. Okay. Weighing evidence on the individual and population level. So when you try to weigh in evidences of its causality on the individual level, you make clinical judgment. But if you're gonna be in the population level, it's epidemiological judgment, which interventions comes in. So when we try to weigh evidences from epidemiological studies, we use causal criteria. Okay, that's why you have, okay, what are the criteria if you're going to have diagnosis like this and that? 5 out of 8 symptoms the patient should be developing this one. That's why we come up, or we try to understand, or we also try to memorize. Okay, is the patient met the criteria of having acute coronary syndrome? Is the patient, so for us to have an easier way to diagnose or see them or make a management or conclusion. That's why this is your also coming up with causal criteria. If it's actually meet the conditions. Okay. So there are Henley Cox postulates in 1877 and 1882. Cox postulated that we come up with four criteria or these should be met before a causal relationship can be accepted between a particular bacteria or disease agent and the disease in question. So they try to investigate what causes this disease. Is this bacteria really this the causative agent? So let's try to come up with a criteria. Let's try to come up if this will meet the criteria or the condition. First, the agent must be shown to be present in all cases of that disease. If you're going to isolate or have a pure culture, okay, that's first postulate. The second postulate, the agent must not be found in cases of other diseases. So that's exclusivity. Okay? And then third postulate, once isolated, the agent must be able to reproduce the disease even in experimental animals. So if you're going to isolate the virus and expose this to not a healthy animal, and then it will develop the disease, then that is the positive agent. And the agent can also be recovered from that experimental disease produced. So these were the days in 1877 that they coming up with the suggestion or criteria that hey, we want to establish the cause of this disease. Let's try to find it out and let's try to make this as our rule. And that is your Henley Fox postulate. However, as time goes by, it will also have develop criteria wherein we try to also associate it with your epidemiologic criteria. And that's why Austin Hill come up with this Hill's criteria. And these are your consistency, strength of association, specificity, dose response relationship, temporal relationship or directionality, biological plausibility or proving it with the evidence, coherence, and experimentation. Okay, let's try to look it one by when we say consistency, it's the same association found in many studies conducted. Hundreds of studies have shown that smoking and lung cancer association, and there is no serious study that failed to show this association. But whether oral contraceptives are really associated with breast cancer is still uncertain because some studies have shown that these are not associated. So we need to have a consistent outcome. We need to have a consistent conclusion. That's why not all researches, you know, not all researches are actually good. You need to dissect it from the time you come up with getting the data, how you able to treat the data. Is this bias? You know, what's the methodology? How are you going to treat the statistics or how you're going to treat the data? You know, there must have consistency. So that's why if you want to start the other study, other research, you need to do meta-analysis. So this is actually a good method of testing consistency. Okay, you gather all researches that proves or tells that papaya soap can actually whiten the skin. So you come up with a study conducted in Colombia, in India, in China, in Africa. And this summarizes the odds ratio from various studies, excluding the bias. So meta-analysis is actually a method of studying other researches or studies. So consistency could either mean an exact replication as in the lab or experimentation in the laboratory, or replication under similar circumstances. Example would be a study conducted in both two countries with the same climate, with the same population, with the same demographic. So this is under similar circumstances. Okay, and that would be your consistency. Okay, strength of association. Is the association strong, heavy association, or heavy smoking associated with a 20-fold higher rate of lung cancer versus a patient who is not a smoker? It could also double the rate of coronary heart disease. So the association of smoking with lung cancer is therefore stronger than its association to the heart disease. So the stronger the association, the more likely it is to be the true cause. Okay? So that is strength of association. It can be smoking can be associated to coronary disease, but not as strong as developing lung cancer. Okay? So when you try to express strength of association, you can actually quantify it by getting the odds ratio or risk ratio. A p-value of 90%, 95% confidence level, or less than 0.05, it would mean there is a smaller or a stronger association. So that is what we mean by your p-value. The smaller the p-value, the stronger the association. If it is less 0.05, so that is your quantitatively. In qualitatively, you accept the alternative hypothesis. So there is an association between the study exposure and an outcome. You reject the null hypothesis, it means there is no association. So that's why you state your hypothesis. There is a strong association. You accept this alternative hypothesis. And then you reject the null. There is no association. Okay? So what do you mean by dose response relationship? If a regular gradient of a disease risk is found to be parallel a gradient in exposure, say for example, light smokers can get lung cancer at the rate of intermediate between a non-smoker and heavy smoker. So there is a likelihood causal relationship. So the higher the dose, no, the higher the response. So dose response is generally thought as a subcategory of the strength. The higher the intake of alcohol, the higher the probability or likelihood of developing liver diseases. That's your dose response. However, the dose response is not relevant to all exposure diseases because disease sometimes only occur if it's above the fixed threshold of exposure. And thus, the dose response relationship need not be seen. Okay, so sometimes you also need to consider the fixed threshold of exposure. Studies have found an inverse relationship between person's blood pressure and the person's serum calcium, but which is the cause and the effect? So the time order can also be uncertain. The disease has a long latent period, or there is a time element. Okay, so this is your time order or temporality or direction. So what would be the effect of this over the time? So there is a time element. In time order, example number 2, low serum cholesterol. You have a low cholesterol level. It is linked in increased also the risk of colon cancer in prospective cohort diseases. So, but a low serum cholesterol a cause of colon cancer? No. Or does an early phase of colon cancer cause a low cholesterol level? We can actually say it can be, no? So there should be a time order. It's also a matter of what comes first, the chicken or the egg. You know, you develop this, but how can you develop this if you don't have this? So which comes first? Okay, specificity of outcome. You try to be more detailed on the specific. So, for example, asbestos is the cause of a specific lung disease, which is asbestosis, which is actually distinguishable from other lung diseases. But low-level lead exposure is associated also with lower IQ. That is also distinguishable from other brain syndrome. Thus, lead is more uncertain as a cause of possible confounding with other causes of rather non-specific effects. So, in this example, yes, lead can be cause of low IQ, but it's really specific as compared to your asbestosis. But you could check that if there's a high level of lead in the blood, then that can also lead to your poisoning, and that would be specific to that kind of poisoning because you are determined to know what is the specific cause of that poisoning or that disease. Okay? Coherence, you have your theoretical, factual, biological, and statistical. Theoretical, or it's compatible with what we have already accepted. Conceptually, no? Factual, it is compatible with pre-existing knowledge, no? It's already known or accepted as a fact. Biological, it's compatible with the current biological knowledge from other species or other levels of organization. Statistical, compatible with reasonable statistical method. So, for example, of your biological appearance, presence of a serological marker of hepatitis B is associated with elevated rates of liver cancer. And so that hepatitis B infection is a true cause of a liver cancer that can also be supported by looking into the viral genome of many liver cancers. That is your biological appearance. By contrast, before an hypertensive drug, which is desert was thought to be cause of breast cancer in the early 1970s. But there were no other supporting biological information or a truly possible biological mechanism. Okay, so another criteria being developed, and this is your Saucer, Mervyn Saucer criteria that is used similar criteria to judge the causal relationship. In agreement with previous authors, we mentioned that the true criteria have to be present for any association that has claimed to be the causal. And this is the time, order, the X precedes the Y, and the direction. The X would lead to your Y. That's your Saucer criteria. Comparing the causal criteria between Saucer and your Hill criteria, you have this time order, strength, consistency, specificity, and your coherence. So in your examination, I'm going to give you, so this is a reference. I'm going to give you some examples, and you're going to give me what kind of criteria, a causal criteria, we are pertaining this. Is it a time order? Is it a strength? Is it consistency? You're going to determine what type of causality, no? And also we have uh, learned the factors, necessary cause, sufficient cause, and things like that. So I would send this to your LO again, and those who are present here can have a screenshot. Please turn on a video. Guys, I am telling you this for the last time. Next discussion, I would expect for you to answer me unless I had a problem with my audio. I want engagement from my class. I want involvement. I want active participation. You are here to learn. How would you learn if your mind is going somewhere else? So you need to be not just physically or virtually present, but even mentally present. Okay? I won't actually ask difficult questions, but rather practical questions. So I think we're done now with our causal inference. It's easy topic. In fact, it's a common sense, but we try to associate them in the study of diseases in when doing research or when doing epidemiology. That's why it's a very important topic for discussion. Okay, thank you for attending the class and for those who are able to answer or participate in the recitation. You are all noted. Okay, thank you. Good day.